Is this your liver? 1 in 3 adults has fatty liver disease, and most have no idea. Fatty liver disease happens when fat slowly builds up inside liver cells. It doesn't hurt at first. You don't feel pain, so it's easy to miss. When you eat, sugar enters your bloodstream. Your liver's job is to grab some of that sugar and store it for later. But here's the catch. Your liver only has so much space. Now comes fructose, the sugar in soda, juice, sweet coffee drinks, honey, and most processed foods. Unlike other sugars, fructose goes almost straight to the liver. When too much fructose arrives too fast, the liver runs out of room. So it does the only thing it can. It turns that sugar into fat and stuffs it into liver cells. And when this happens day after day, the fat builds up. The liver gets so crowded it can't do its regular jobs, cleaning the blood, managing sugar, or helping digest food. And here's why this is dangerous. Blood tests can still look normal while this is happening. This disease has long been associated with alcohol use, which causes many to overlook the possibility, even when symptoms are present. Why? Because their blood tests often look completely normal. But people notice things like fatigue, brain fog, bloating, or weight that won't budge, even when they're trying to eat better. And here's the key point. Blood tests look for damage, not fat. So your liver can be full of fat while labs still say normal. That's why this condition quietly progresses for years. If untreated over time, fatty liver disease can progress from simple fat buildup to inflammation, scarring. Some people eventually develop cirrhosis and eventually permanent liver damage. One of the biggest myths about fatty liver disease is that it only affects older adults. That's simply not true. I have seen patients as young as 13 years old come into my office with severe right-sided abdominal discomfort. Patient was not overweight, didn't drink alcohol, and no one suspected the liver. When we tested, we found the patient was positive for fatty liver disease. The cause wasn't genetics, it wasn't medication, it was the high sugar diet. Sugary drinks, processed snacks, and constant sugar exposure had overloaded the liver at a very young age. That case changed how I talk to patients about fatty liver disease, because this condition is no longer about age. It's about what the liver is being asked to process every day. The good news, your liver is one of the most forgiving organs in your body. When caught early, fatty liver can improve with simple changes. Cut fructose, eat protein first, and move after meals. So the real question is, has your liver ever actually been checked for fat? Fatty liver is often silent but reversible when caught early. If this surprised you, like, subscribe, share, and follow. And comment liver if you want to learn how to protect yours.